William Moore, a former flight attendant, didn't worry about the small changes happening with his eyesight until a traffic incident made him take action. He turned to Dr. Daniel Dotson at North Oaks Eye Care Clinic for help.
What brought me to Dr. Dotson's office was I was driving through a construction zone at 11:30 p.m. at night in Covington on 190, and I knocked over 3 5-foot tall orange cones, and the damage to the car was it knocked my outside rearview mirror off. And it was a humbling experience. It kind of shook me. So I made the appointment to go in and have the assessment.
A cataract is a clouding of the eye's lens, making it difficult to read or drive, especially at night. Cataracts can happen to young people too, but it's usually not a problem until after the age of 50.
I've worn glasses for about 15 years previous to the surgeries, and I was told early on that I have cataracts in both eyes, the left eye worse than the right eye. And so I'd known that I was going to have the surgery at some point, but I always felt like, that's for old people, and I kind of put it off in the back of my head. And my cataracts grew quickly. Before you have the surgery, you have to meet a certain criteria, and once I went in for the assessment, I had already met the criteria, and then it was time to do it. I mean, I noticed my eyes had been failing, my vision had been failing for distance, reading signs and stuff while driving, probably for about 2 years, and I just put off making the appointment and taking care of it.
As people age, the lenses in the eyes become less flexible, less transparent, and thicker. As the cataracts progress, symptoms begin to appear.
Towards the end, it was like a smear of Vaseline on the lens of my eye. It was very clear that something was wrong, and I would always close my right eye. I would close my left eye and look out of my good eye, and I noticed the deterioration in the left eye. So I had that surgery first on the left eye. And after that surgery, I just couldn't believe how horrible the vision was in what used to be my good eye, the right eye.
Cataract surgery is usually done on an outpatient basis and has a typical recovery time of 1 week.
I went in for the assessment on both eyes and was told that I meet the criteria for having the cataract surgery and we could set it up straight away. I had the surgery on my left eye done about 7 days after that initial assessment, which happened to coincide with 2 days after starting a nursing curriculum at a local college here in Hammond. The very next day after the surgery, I was in class with dark glasses on and never missed any of the curriculum throughout the rest of the summer. I did wait to have my right eye done because he wanted to schedule me straight away, like 3 weeks in between the surgeries, but I was doing clinicals at a nursing home with this nursing program and couldn't take the time off.
If you are experiencing symptoms of cataracts, see your doctor. As William quickly discovered, the benefits of having the cataract surgery go far beyond great vision.
It's unbelievable. It extends way further than just good eyesight. I mean, it gives you confidence, and I've seen the effects in a lot of areas in my life. Basically, confidence. It gives you a lot of confidence. You don't realize all the things you do to compensate for poor eyesight because you don't really realize that you have it until you don't.
When it's time to get your eyes checked, look no further than North Oaks Eye Care Clinic.
Dr. Dotson made me feel comfortable. He has a way of leaning in and listening to you when you talk, and I just didn't have any apprehension at all once we went through the assessment, and he told me everything that was going to happen, explained everything in detail, and talked on my level, so to speak. He's a real friendly guy.